It's a bold claim to say that dietary supplements are changing the landscape of health and wellness in America. But despite the fervent support of figures like Health and Human Services Secretary Robert F. Kennedy, Jr., tangible progress in Washington seems distant for this multi-billion-dollar industry. Kennedy, a notable advocate for various dietary supplements, has surrounded himself with a network of senior staff, advisors, and health influencers who actively promote a wide spectrum of products, from weight loss capsules to supplements made from desiccated organ meats. However, strikingly, these efforts have yet to translate into meaningful advancements within the political landscape. While under the slogan "Make America Healthy Again," Kennedy's agenda has raised eyebrows by scrutinizing vaccine usage and criticizing artificial food colorings, alongside proposing cuts to personnel and research funding within federal agencies, elements that diverge from the supplement industry's primary interests. Despite a warm reception from Trump administration officials, concrete policy shifts that the dietary supplement sector has long desired, such as simplifying the purchasing process for consumers, holding dishonest manufacturers accountable, and granting producers greater freedom in health benefit claims, have not been realized. Additionally, governmental policies aimed at regulating food additives and import tariffs have posed fresh hurdles for supplement manufacturers. Steve Mister, president and CEO of the Council for Responsible Nutrition, expressed a mix of optimism and frustration. "They seem willing to engage in dialogue and listen to our concerns, but we aren't witnessing the decisive action we need to elevate these issues," he said. "So far, it's been a waiting game with little progress that truly empowers our industry." Dietary supplements consist of a diverse array of products, ranging from vitamins and minerals to herbal extracts and food-derived items. Their popularity has soared, culminating in a market worth approximately $69 billion in the United States last year. This remarkable growth illustrates just how prevalent supplements have become in everyday wellness routines. Prominent cultural figures like podcaster Joe Rogan have further fueled this enthusiasm, endorsing products designed to enhance cognitive function and athletic performance. Likewise, Dr. Mehmet Oz, during his confirmation hearing to lead the Centers for Medicare and Medicaid Services, faced backlash for promoting supplements he labeled as magic cures for weight loss. This spotlight on dietary products has initiated discussions on their efficacy and safety. Kennedy himself has advocated for raw milk consumption and featured wellness advocates who market freeze-dried organ meat capsules, a niche but lively segment of the supplement market. However, both supplement firms and the influencers who endorse their products have faced scrutiny over exaggerated claims regarding health benefits, leading experts to warn that much of the enthusiasm surrounding these products is often driven by marketing rather than robust scientific evidence. Dr. Peter Cohen from Harvard Medical School noted, "I believe in the benefits of supplements, yet a significant portion of their use lacks solid evidence, relying instead on marketing strategies." While the industry is regulated to an extent, dietary supplements do not undergo the same rigorous approvals as pharmaceuticals by the FDA before hitting the shelves. This lack of pre-approval leads to potential risks, particularly as some supplements may have adverse effects, prompting several states to contemplate legislation that would prohibit the sale of specific weight loss and performance supplements to minors. Proponents of dietary supplements argue that they rigorously uphold safety standards and assert that the notion of a completely unregulated industry is a misconception. They contend that while health claims regarding disease prevention must adhere to stringent federal regulations, classifying such products as drugs if they make these claims, unnecessary constraints exist that stifle innovation. In a recent statement, the Department of Health and Human Services reinforced the importance of consulting healthcare providers when selecting dietary supplements, emphasizing the need for guidance in making informed choices. In a podcast interview following his presidential campaign launch, Kennedy shared insights into his personal vitamin regimen, joking, "There are so many, I wouldn't even remember them all if I tried to count." Alan Sudberg, CEO of a botanical testing firm and board member of the American Herbal Products Association, regards Kennedy's focus on alternative medicine and criticism of pharmaceutical companies as a pivotal opportunity for the supplement industry. Meeting Kennedy in November 2023, he candidly expressed, "We really need a champion for us. I've heard you're a big fan of what we do." However, some of Kennedy's supporters have expressed disappointment over the lack of substantial progress they envisioned, from easing restrictions on raw milk sales to eliminating harmful pesticides in food production. Similarly, others in the supplement industry share sentiments of frustration regarding the administration's insufficient proactive stance. There's a glaring absence in addressing nutritional gaps, focusing instead on the reduction of certain products and ingredients, which seems rather narrow-minded, Mr. lamented. After taking office, Kennedy turned his attention to an FDA policy that permits the introduction of new food ingredients without formal approval, provided they are deemed safe. A process he argued allows food companies to exploit regulatory loopholes and jeopardize consumer safety. This initiative raised alarms among diet supplement groups during discussions with the FDA, as they relied on the FDA's guidance to introduce innovative products. Reassurances from Duffy McKay, who oversees dietary supplement policies for the Consumer Healthcare Products Association, highlighted a community reliant on the agency's assurances. Moreover, the imposition of tariffs on imports during the Trump administration struck a chord with supplement manufacturers, as many crucial ingredients are sourced internationally. Although some industry representatives successfully lobbied for exemptions on popular vitamins and minerals, other essential components remain impacted by these new economic policies. The tariffs introduced uncertainty into businesses relying on foreign sources, like Herbalist Alchemist, which sources herbs from various countries. CEO Beth Lambert noted that while Kennedy's MAHA initiatives hold promise for the industry, the current tariff situation has posed major challenges, complicating business operations and disrupting supply chains. Nonetheless, optimism persists among manufacturers who see this as a pivotal moment to advocate for their interests. Callie Means, an aide to Kennedy and founder of a health product startup, took the stage at an industry event to foster collaboration between Kennedy's office and the supplement sector. Industry leaders are pushing to include supplements under federal programs such as Medicare and nutrition assistance programs, recognizing the historical precedents for utilizing vitamins like vitamin C in promoting public health. Sudberg pointed out, vitamin C has been recognized for centuries as critical for overall health. Yet, it's inexplicable that you can't buy it using your health savings account. Despite appeals to Congress during discussions around Trump's massive spending bill, lawmakers hesitated due to budget implications. Recently, 5 industrial trade organizations urged the administration to amend tax codes to align with their vision for health and nutrition. Separately, advocates are urging the FDA to revise its regulations, making it simpler for supplement companies to convey health benefits associated with their offerings. Currently, the FDA employs a rigorous and lengthy process for approving health claims, finding significance only in claims supported by substantial scientific evidence, resulting in limited approvals over the years. Groups like the Alliance for Natural Health are vocalizing concerns over perceived constraints limiting the industry's ability to relay essential health information to the public. They aim to propose a petition requesting the FDA permit many more health claims based on emerging research. Amidst this, some public health advocates warn about the potential for companies to manipulate consumer perception should the FDA acquiesce to such requests, allowing vague health claims that may not genuinely reflect product efficacy. Nonetheless, industry representatives assert their commitment to honesty and transparency, addressing fraud and misleading claims, while also cautioning against significant staff reductions within federal health agencies that might hinder regulatory enforcement and research involvement. Jim Emmy, CEO of Now Health Group and part of the Natural Products Association, shared hopeful feedback from recent talks with the FDA, hinting at potential conversations regarding Medicare coverage for supplements and mothers' concerns for their children's nutritional needs. "This is a critical window of opportunity for us, one we need to seize," Emmy said. "After all, we're in an election cycle. The landscape can shift significantly, and we must act while we have the chance. As discussions evolve and stakeholder perspectives continue to develop, the future of dietary supplements and their place in broader health conversations remains a topic ripe for ongoing examination. What are your thoughts? Should the government take a more hands-on approach to regulating the supplement industry, or do you think current regulations are sufficient? Let us know in the comments.